You often hear about celebrities getting their lip fillers dissolved or their fillers reversed, but what does this actually mean? Well, stay tuned because in today's episode of Dr. Noor, I take you through everything you need to know about what happens when we dissolve fillers or reverse them and what it actually looks like in real life. When we talk about reversing fillers or dissolving fillers, we're talking about the fillers that are reversible in nature or otherwise known as hyaluronic acid fillers. Now, there are a whole multitude of different fillers on the market, but we're specifically talking about the hyaluronic acid fillers. When we come to dissolving these fillers, we're using a medicinal enzyme known as hyaluronidase. Now, this is an enzyme that acts as a catalyst to the degradation of hyaluronic acid. So therefore, when you inject it into the area, eventually what happens is you get the degradation of the hyaluronic acid that you've injected, but also the hyaluronic acid of the patient themselves. So the dissolving process isn't just specific to the filler, it can also affect the patient's natural hyaluronic acid. Now, this is super important if you are considering having lip fillers dissolved, because you may go in there and think, oh, I'm just going to get rid of my lips, for example, but actually things might not go as planned. More on this later. But why would we even dissolve filler in the first place? There are a few situations where filler can be reversed, and the first of which is an emergency situation. Now, obviously, as with any procedure, there are risks. And with fillers, there's always a risk that there could be a chance of getting a vascular occlusion. Now, this means that the filler is either directly injected into a vessel, causing an occlusion of the blood supply, meaning that there's no more blood that can flow through, or it's injected close to that vessel and it's causing a compression from the outside. So again, no blood can flow through. The consequences of both these situations is that you can get tissue necrosis, or the tissue around the area starts to die off because it no longer has a blood supply. So in these situations, it is vital to reverse the filler as soon as possible so that we avoid any permanent damage. In other situations, somebody may choose to get their fillers reversed electively, meaning that there isn't really a big major emergency, but perhaps they've changed their mind about fillers, they don't like the look of it, perhaps it looks asymmetrical, or maybe even they've developed some complications along the road, which could include things like lumps and nodules or granulomas that can occur as time passes. And certainly these patients will come in and they won't be in an emergency, but they'll come in wishing to reverse their fillers, and perhaps they might want to try again later. But how do we actually reverse the filler and what is involved? Well, I'll have a separate video very shortly on showing you how the enzyme is actually reconstituted in real life, just to give you an idea. So as we said, there's two ways that we can reverse filler, whether it's an emergency situation or a non-emergency situation. And when it comes to actually practically speaking on the patient's lips, either we can inject into the area, for example, if they've got a lump, we can inject into that lump, or we can inject around the area and simply massage the enzyme into place. The solution itself is quite watery and it does spread quite rapidly into the area that it's been injected into. So going back previously into what I said about not being specific, if it is injected, say, into the lips, you might also notice that the patient's natural hyaluronic acid starts to degrade as well. And the enzyme retains its functionality for up to 6 hours after injection. That means that, yes, whilst your practitioner is massaging the area, trying to get the enzyme working, it will still continue to degrade after about 6 hours, and full effect might be apparent after 72 hours. This means that you may need to go back in for further injections, perhaps in that day or a few days later, to get your optimal results. Warning, however, before you get all excited and go get your fillers reversed, I must tell you that your practitioner should definitely do a patch test or an allergy test on you before injecting any of this enzyme into you. The reason being is because there is an incidence or a slight chance that some people will react quite negatively to this enzyme, and reactions could include anaphylaxis, which means that you have difficulty breathing, you get throat swelling and tongue swelling, which can be a life and death situation. So if you are considering having any of these procedures, then please make sure that you do research an adequately qualified healthcare professional to do this for you and do it the correct way. Okay, that's all well and good, but what does it actually look like in real life? Well, this is the moment you've all been waiting for, because right now I've got a demonstration to show you how filler is actually dissolved in real time using this enzyme. As you can see here, we have got the solution inside the syringe, and we've got the filler on a teaspoon. Now, this is actually 1 ml of filler injected onto the teaspoon, so standard size teaspoon. So 1 ml of filler isn't that much, but once we start injecting in the solution onto teaspoon, we can see that the filler, which was initially quite firm, is actually starting to loosen up a little bit. And if we just pretend that we're massaging the filler, which we would do in real life, we'd massage the area that we've injected into, and we're just mixing up the filler with the syringe needle. You can see that slowly but surely, if we inject a little bit more of the enzyme into the area, the filler actually starts to become a lot looser. And this is what will happen in real life as well. So the longer you leave the enzyme working its way, it will, like I said, cause that degradation of the hyaluronic acid, and it will start to break up the filler. Now, the quantity of the enzyme that is required does vary according to the type of filler that was used and obviously the quantity of filler that was used as well. So your practitioner will be able to advise you on this according to your own individual circumstance. But look here, we can see that the filler has literally become liquid. That is amazing. You're probably thinking, well, what happens once that filler is just floating around in my system? What happens then? Well, the next course of action is that the remnants of your procedure will actually start to just drain into your lymphatic system and they'll get excreted through your kidneys. Once you've had your filler dissolve, you might think about getting it re-injected at a later stage. But when would you consider doing this? Well, we always recommend waiting at least 2 weeks from dissolving your filler to having a re-injection in that area. So there you have it, guys. That's a live demonstration of what filler looks like when it's being dissolved, and also all of the tips and tricks you need to know about considering when you are having your own filler dissolved. Let me know what you think in the comment section below. And of course, I hope you guys have found this video useful, and I'll see you on the next one. Take care and stay healthy.